Se acostó en el sillón y le dio un sueño y luego se quedó. Luego llamé a la ambulancia y cuando llamé a la ambulancia rapidito a los 15 minutos llegaron la ambulancia, me lo llevaron para Jonte y de Jonte me lo mandaron para el hospital de Kendall. Del hospital de Kendall él cayó en coma.
Estuve en coma 3 meses. Cuando desperté yo no hablaba, esta mano no la movía nada.
I first encountered Mr. Morejon on a call night at the beginning of September. My nurse practitioner from the hospital called me and let me know that we had been consulted on a gentleman who was critically ill in the ICU. He was very young, in his 40s, and had been transferred here from an outside hospital with sepsis, COVID positive, and having suffered multiple bilateral strokes. The patient was comatose and was experiencing brain swelling from the infarcts or strokes that he had experienced in his brain. We were just beginning to understand at that time that COVID made people more likely to have strokes, and that we were seeing strokes in young people who were COVID positive where we wouldn't normally expect to see stroke. Mr. Morejon's brain was starting to swell, and in fact, in the right-sided stroke, he had suffered what we call hemorrhagic transformation. And what that means is that the area of his brain that had experienced a stroke had bled as well. So he now had a blood clot inside this swelling area of stroke. And it was starting to press on his brain, and we could see that in things like his blood pressure and his heart rate. This CAT scan here is what Mr. Morejon's brain looked like the night that I was first consulted for him. He has a smaller stroke here on the left side. On the right side, it's a larger stroke, and you can see this white area here, and that's where the hemorrhagic transformation has occurred, where he's bled into the stroke. The stroke is this darker colored. As a neurosurgeon, I'm not really a stroke doctor. The neurologists and the interventional neuroradiologists are the people who take care of and treat stroke typically. However, for some small groups of patients who have suffered a completed stroke, we sometimes play a role in decompressing the skull to allow the area of the brain that has already been damaged by the stroke to swell without injuring the good brain that's still there. We do a procedure called a hemicraniectomy, and that's where we remove a portion, sometimes up to as much as nearly half of the skull, because that allows that infarcted or dead tissue that has already suffered a stroke underneath to swell out as it's going through its swelling phase, rather than to swell in and press on the remaining brain that is still good, and that can be life-threatening when that happens. This is after the surgery. We took off a piece of the bone, as you can see, and it's allowed the brain to come out of the bone itself and not swell inward. Hearing that the patient's wife and he himself have expressed that they feel happy that we did this surgery, and that they had worries and concerns that maybe physicians would have looked at him and felt like he was too far gone, is really a very poignant thing for me to hear. I did wonder if I should be doing it. You don't want to, as a surgeon, operate futilely, and you don't want to put patients through something that you don't think can help them. But looking at this, hearing that, it reminds me that we have to be very careful about making those decisions, and we have to remember that there are people who really have a life ahead of them that's worth saving.
Gracias, doctora Guaire. Le agradezco mucho lo que ha hecho con José, y yo también estoy muy agradecida con usted por esto lo que ha hecho con nosotros y la familia también.